Okay, so let's talk about this keloid and hypertrophic scar again. So why is so hard for us to manage the keloid and hypertrophic scar? Because it's actually a complex problem. Because when the patient with the keloid and hypertrophic scar, they come to us, it's not only all about the cosmetic appearance, it's also about its significance on psychologists and the quality of life. And actually, this condition, and these conditions only have the high rates of the treatment refractory, the relapse, recurrent, and also the treatment outcome is variable. And you know that, so even that that these conditions confuse a lot of physicians, including us, and even that we have the very useful, powerful weapons, the steroid therapy, considered to be a gold standard and to be very effective in managing keloid and hypertrophic scar. However, sometimes the higher risk of the side effect and the patient cannot accept it. So then, fortunately, thanks to the advancement of the technologies, the exosome has been introduced, have been emerged, and at the beginning, it has been widely used in many rejuvenation and recovery procedure. But recently, many researchers have reviewed that exosome can be the significant potential in many cosmetic dermatological conditions, including the keloid and hypertrophic scar. And from that on, lots of questions arose regarding to its application on the keloid and hypertrophic scar, which are, firstly, how the exosome can be effective in treating and managing the keloid and hypertrophic scar. Secondly, when we apply the treatment method to the certain condition, we're really concerned about the safety and the exosome. In our dissection, we need to know is the exosome safe to use? And last but not least, can exosome replace the steroid therapies in the near future or not? And all of these questions will be the main content of my presentation, and all the response will be all the questions will be responded throughout my presentation. Okay, so before we go on a very detailed, there is one picture I found it really interesting, and I want to share with you. So now you just imagine that the keloid and hypertrophic scar, it looks like the bell. Okay, so the progression of the keloid and hypertrophic scar is look like the bell ringing continuously. So in the normally in the normal status, the bell maybe just ring for a short period of time, but then it will stop. But because of the disorder, because of something problem, and the bell is ringing non-stop. So what would you do if you meet that situation? So for the logical thinking, most of us, including me, we have the unconditioned reflex to find the switch to turn it off. And of course, it worked, it stopped. The bell doesn't ring anymore. And yes, but the problem is that if the error system is not fixed, and then when we turn it back on again, the bells continue to ring, and it will disturb us again, make us annoying and uncomfortable. And then it leads to the second option. Then we try to fix the error system. We try to fix what happened inside the bell. We try to fix the error system, and then even that we turn the bell again. Maybe it's just ring, but it's just again, but it's just a short time. But then it will stop. It will stop, and creating the long-term stability. Okay, so why do I mention about the image? Because the image represents two separated approach in treating keloid and hypertrophic scar, with two representatives for each group, respectively, the steroid therapy and the exosome. And I think that for this image, maybe all of you here have the practical ideas of how the exosome can control and manage the keloid and hypertrophic scar, right? And if you don't, no worries. We will go on the details in the next following slides, step by step. Okay, so this slide just remind you the basic concept about the keloid and hypertrophic scar. And basically, the keloid and hypertrophic scar is the types of the fibroproliferative disorder. So simply speaking, it's the imbalance between the collagen production and the collagen production and the destruction. Yes, and we have the hypertrophic scar and we have the keloid. And this slide summarizes some characteristics differences between two types of scar. This will help you to prognose and predict the outcome when we treat the patient with the keloid and hypertrophic scar. But actually, it's very useless in the clinical practice because sometimes the physician, they cannot clearly distinguish between two types of scar. So from the latest recommendations from the Japanese Association, they recommended that whenever, they said that in the recommendation, they said that the keloid and hypertrophic scar, they just look the same. And the keloid, it is just the exacerbation of the hypertrophic scar. So whenever the patients come to you, you don't care the patient got the hypertrophic scar or the keloid, you don't care what type, you just take the patient, you just treat the patient at the keloid case, which means that you will initially take a active approach for this patient. Okay, and of course, there's a lot of factors stimulating the formation of the keloid and hypertrophic scar, and which can be divided into the host factor, local factor, and the environment factor. So this slide just emphasizes one thing, that if you want to treat, you want to manage the keloid and hypertrophic scar effectively, you don't just only focus on the target therapy, just on the fibrous tissue. You need to focus the other factor, because sometimes we just focus on the target therapy and we don't control all the factor, and the results is not like what we want. Okay, so when we treat the condition, we want to treat the condition, we want to treat the disease. We need to know the mechanism of that disease and that condition, right? And for the keloid and hypertrophic scar, another exception, we need to know the mechanism of the keloid and hypertrophic scar. So there are so many causes leading to the formation of the keloid and hypertrophic scar, which can be divided into two main categories: the primary causes and the secondary causes. So in contrast to the secondary causes, where the keloid and hypertrophic scar is just one of the manifestation of another underlying condition, the primary causes is the results and the consequence of the abnormal wound healing, right? So we're talking about the secondary causes. If we treat the underlying condition, and then the scar will disappear, so there's nothing much to talk about. So our presentation just focus on primarily on the primary causes. So because it's in the consequence, the result of the abnormal wound healing, so we need to know how the normal wound healing. So actually, the normal wound healing is a normal process, is a complex natural process with the involvement of varieties of cell mediator, and there are four main stages, including the hemostasis, inflammation, proliferation, and regeneration. However, the role of the hemostasis in the scar development is not very significant when compared to the remainder. So when we're talking about the hypertrophic scar, we just focus on three main stages: inflammation, proliferation, and regeneration. And this, the diagram you are seeing right now on the right side of the screen, they summarize the differences between the normal wound healing and the excessive scarring process. So you can see that in the normal wound healing, each day, you can see that it just lasts for a certain period of time, and the level is just mild to moderate. But however, when compared to the excessive scarring process, the level are more intense, and all the stages is last longer than normal. And there are three main characteristics in the excessive scarring. We can see here, this is the persistent inflammation, the excessive collagen production, and the deficiency matrix degradation. So these are three mechanisms of the excessive scarring, or we can say the keloid hypertrophic scar. So we know about this mechanism, then we know how to, if we want to manage the the keloid and hypertrophic scar effectively, we need to control all of the mechanisms, which means that we need to control the inflammation. We need to suppress the collagen production, and we need to promote the matrix degradation. That is the key point if we want to control the keloid or hypertrophic scar effectively. And this slide showing you is help you to explain why the steroid therapy are very effective in managing the keloid and hypertrophic scar, because the steroid is attack all the, it targets all the mechanism of the keloid and hypertrophic scar. So which is explain why it, the steroid is one of the current, its most frequent methods in many recommendations and guidelines. But like I told you earlier, the steroid is have a lot of side effects, so we cannot use it for long term. So because it have the strong suppression, so then we can see the fast result. But when we stop using it because of the side effect I told you, then all the suppressions, all the reductions, they will be reversed. And when it will be reversed, we have the relapse and recurrent clinically. So I think that maybe this is the failure of the steroid therapy. So this failure make the researchers, they have to revisit this matter again. They have to think it. They don't think it in the big picture anymore, like what I just showed you. They don't see it. They have to see it in a different way. They have to see it in a different aspect, and they choose to see it in the molecular biologies. And then they introduced the new concept about the keloid and hypertrophic scar. They introduced a concept about the skin keloid microenvironment. And basically, it is the local environment around the fibrous tissues. And when they deeply investigated into this environment, we observed something previously we misunderstood. For a long time, we think that the fibroblast is the central role of the problem, and all the therapy, including the steroid therapies, were initially designed to target this traditional concept. But then, when this, the concept is introduced, this concept highlight that the scar development doesn't result only from the fibroblasts themselves, but it's also from the complex